Hey, this is Hany Demian. I'm a doctor, regenerative medicine expert, anti-aging consultant, entrepreneur, and I'm here to help you fight aging. Not only aging, but why would you live in pain while you don't need to suffer?
You're watching Success, Motivation, and Inspiration, where we share interviews with incredible leaders who are crushing it in life and business.
Hey, welcome back to Success, Motivation, and Inspiration. This morning, I'm interviewing Dr. Hany. You worked in all kinds of different countries, lots of different practices, running multiple clinics. Now, practicing in the U.S., Canada, and Egypt, as well as Dubai, what shaped your perspective the most?
I learned early on there is no such thing as a perfect healthcare. Curtis, there's no such thing. Dubai is great. Egypt is great. Canada is great. Healthcare system is unipayer. The States are just amazing, state of the art, but nothing is perfect. So our job as leaders is to help bridge these gaps in any and every healthcare system to reach to the mainstream patient and give them what they deserve.
Now, you started out as a trauma surgeon before expanding into pain management and regenerative care. What moment basically shifted your path? Was there anything
I
specific
love
that really
trauma.
changed?
Yeah, I love trauma. I love the emergency. I love the thrill, the adrenaline, right? But you don't get to follow your patient through their journey. It's one visit and that's it. You hope and the patient hope that they will never see you again, basically, because it's not really a pleasant encounter. But what if I wanted more for my patient? I always wonder what happened to this patient that we saved and I follow them. I try to call them weeks later, right? I try to hunt them down, like my nurses used to say, just to catch up and see what happened.
Yeah.
How's your leg? How's your chest? How's your head injury? Right. And I just couldn't get enough. So I decided to look for something that will help me follow the journey of the patient through and through, from injury to recovery.
Now, that's one thing I loved about you, just seeing a little bit about other podcast interviews that you've done. And then on our pre-interview call, I could just tell you're somebody that really loves people, loves helping people, loves that connection. And that's a big reason we've got you on the show today. There's a whole lot of doctors, a whole lot of anti-aging specialists, but I'm excited to have you on because it's something where I could tell you really wanted to help people, not just trying to make money. Now,
I do. And I learned that from my dad. They said he always taught me, do what you love and love what you do so that you will succeed. Money will come after. Money will catch up. Just always add value wherever you go. And I learned this early on when I finished high school. I went to apply for business school because I really love business. I don't like to have like a boss, like I always said. But during this period when I was going to apply, an event happened in Egypt. There was a terrorist attack and bombing at the school that I was going to apply for business and shifted my life, shifted my perspective. I stayed all day helping victims, trying to help them get better, trying to help them get to the hospital, patch them up. It was just a life changing. I went home, covered in blood, and I ripped my application for business school. And I said, no, I really would like to pursue something to help people more.
I mean, that's a powerful thing that changed your trajectory. And it sucks that happened to everybody there, but what a cool thing. What a cool thing that happened as far as letting you kind of decide your future. Go, you're going to help. I mean, I don't know how many tens of thousands of people you've helped. How many clinics do you run currently?
If this wasn't a message, Curtis, slap in the face that, okay, you are not going to business, get your ass to medical school, I don't know what will be. We have right now, we've got 12 clinics in Canada, and we've got 7 clinics in Florida and 2 surgical centers, one in Orlando and one in Tampa. And we're currently building the first private surgical center in Canada. We're hoping to be in Dubai next year as well. We are expanding. We really hope to reach as many patients as we can.
And now you lead Praesentia Healthcare, BioSpine, and pain care clinics. Give me the simple version of basically the mission that connects them all.
It's a very simple mission. We really would like to follow the patient through and through, like I said, from the day of the injury all the way through to recovery and beyond, right? And the way I see it is I've done chronic pain management for probably like 20 years now. And it was just conventional pain management, whether it's an injection, a steroid injection, we added all what we can, whether it's PRP, stem cells, or whatever, right? but the patient are not recovering and are getting worse. So we decided to, why not control the other end, which is surgery? So we bought BioSpine in Florida, one of the best and cutting edge, minimally invasive. They actually developed this kind of technique through a 5 millimeter incision to do spinal stenosis, laminectomy, fusions, and it was really just cutting edge. And we took it to the next level by doing even microscopic surgery. But there are a group of patients in the middle that are not getting better, Curtis. They're not conventional, don't like the conventional treatment coming for an injection or epidural every 3 months, and they're not ready for surgery. That's, by the way, including myself. So I decided, you know what? We need to look into something in the middle. What about regenerative? What about stem cells? What about peptides, anti-aging? There are stuff that actually can improve and empower the body to heal it.
Yes,
and this
sir.
is where we came in really strong. And I made this a passion, and it becomes an obsession in my life. For myself, I'm not ready for spine surgery, and I'm not getting better with conventional. So honestly, it started as a selfish cause, and now I wanna really expand to every and each patient with back pain.
Now I'm not sure if this is actually your goal or not, but the more research I was doing on you, you're basically showing up similar to like Gary Brecka and a lot of these guys that are not really biohackers, but just anything you can do to help people live longer and live better. You talk about bringing regenerative care and longevity care to the mainstream patients, not just celebrities or elite athletes like a lot of these other guys do. What fuels that mission?
What fueled this it all started, Chris, by, all right, I can help you with osteoarthritis. I can help you with rheumatoid arthritis, back pain, injury. But what if I can prevent it altogether, right? When you look deeply in the cellular medicine, which is expanding and booming, it's one of the youngest subspecialty now in medicine, right? So when you really look into it and you look into the cell, it could be prevented. What caused this cell to break down? What caused this mitochondria inside the cell to break down, causing arthritis, pain, or nerve compression, or whatsoever, right? You look at it and said, oh my God, it could be depending on your genetics, whether it's family, whether it's some sort of mutation in the genetics. So we look closely in the genetics. We get into genomics, which basically how the genetics all together work together. And then we decided, you know what? This could be prevented. So why don't we go back?
Awesome.
Yeah, back in the past of each patient and look into this genetics and genomics and see, you know what, Curtis, I think you will develop degenerative disc disease in your spine if you don't exercise, if you don't sleep properly, if you don't cut back on the sugar, if you cut down on your weight, if your habits are this or that. So we started all the beginning. What if we can prevent this? And in my opinion, this is going to be the whole main idea of my book. What if aging could be prevented, right? With what comes with it, Curtis. Whatever,
Yeah.
it's a thin skin, arthritis, bones, aches and pains. I've treated thousands of patients and I always heard it from them, oh, because I'm old. Because you're old, you don't have to age. It's totally different. So what if we can prevent it? And this is where all our research coming into place. Why we dive deeper into genetics, genomics, and epigenetics. If I can, like you're sitting in front of me and you're 30 years old, but your cells are really developing or growing at a faster pace 10 years ahead. So your chronological age is different from your biological age.
Yeah.
What can I do? And it becomes so simple. It becomes so simple. Drink more water. Why didn't you eat collagen-rich food, right? Like have some bone marrow or some broth or eat a little bit of iron-rich food. What if I can do
Impact
that?
training, yeah.
It doesn't need to have tens of thousands of dollars infusion and all the famous stuff that they do online. It could be something that you do early on that can prevent you from going through this.
Now, do you find, you may know, I used to own a cosmetic medical laser clinic and a company that manufactured bioidentical injectable research peptides, pharmaceuticals, basically white label manufactured pharmaceuticals from Abbott Laboratories, one of the major U.S. pharmaceutical manufacturers.
Yeah.
We had a lot of problems where we'd get a fax from the DEA this back, tell you how long ago that was. We'd get a fax and saying now a lot of these projects were scheduled, meaning it's a felony to possess. We could not have the entire supply that we had. And so we're dumping $30,000 worth of wholesale product, just tossing it because you go to prison if you get caught with it now. Is it different trying to practice in the U.S. doing these regenerative and alternative care things than it is in Europe or Dubai or these other places?
It's totally different. The US, in my opinion, is not the wild, wild west like Europe or Asia. It's controlled, but when I say that, it's totally different than Canada. Canada is extremely controlled. Canada is extremely obliterating any new ideas. Like if you have any idea, you know what I mean, they shut it down right away. The US will listen, and if you have a good research, they will have somebody's ear to do it. And things are opening up significantly through peptides. FDA approved a lot of peptides because there's a lot of research about it. The amino acid, like the branched chain amino acid that you get on at the gym, right? So it's really opening up. And recently, Florida, the state of Florida, opened up for stem cells, not being approved by FDA, as long as you know what's the source, you disclose to the patient that it is still in research, and patient looking for that. So why not?
Yeah.
Still a long way, but I believe that all the names that you mentioned, Gary Breca, Andrew Huberman, and Peter Attia, we are leading a movement, an education, right? And it's not easy. Anything in the beginning, you probably were a little bit earlier on time, but if you try to do it again now, I think you will have an easier time doing it. Things are really moving in the right direction with the right research. As long as you're not trying to be a cowboy in the wild, wild west, it will work. It will work. But there are people that taking it beyond. And I've seen it through influencers, which made me actually start being active online, right? I never wanted to be online. I never wanted to be that, but I had to when I seen a lot of influencers pushing in the wrong direction.
Yeah.
A lot of spreading a lot of myth about it. I couldn't take it anymore.
Yeah. Talking about being the kind of the wild cowboy type of thing. I think we launched our clinic in 2005 or 2006. And so everything that we were launching was nobody had ever heard of it before.
Yep.
We had the Denver Police Department, Denver Fire Department, the Broncos cheerleaders, I mean, all these people that were using that. These police guys and stuff were using it because it was a legal alternative to steroids. You know, you could do site-specific things for muscle growth and regeneration.
Yep.
But again, it was nobody had heard of it. They didn't know if it was a drug or not. It's injections, so it seemed like it was we probably looked like the local crack house in a in a medical clinic there. But
you were just ahead of time, Curtis, and there's nothing wrong with that. You know what I mean? A lot of people were ahead of time in a lot of things like hormone replacement therapy, peptides. Like peptides started, I remember, a few years ago by MK677, and everybody was hush-hush about it, and nobody wants to talk about MK. It was a gym supplement. Look at it now. It's an alternate universe of medicine.
Now, you personally used a lot of these therapies yourself that you offer. What experience changed your thinking the most as far as, did you experiment on yourself, or was it something that you went to another clinic? Or
never advised anybody with anything without trying it. During COVID, I felt I wasn't recovering. Was it because of the lockdowns? I don't know. Was it because of aging? I wouldn't mention my age, but whatever. I couldn't recover. I took every single pre-workout, post-workout, and it was just not doing it. So I decided to look deeper, and I looked into peptides. A lot of people start talking about it, including Joe Rogan and Liver King and whatnot. So I decided, you know what, let's give it a try. So I did my research, and I decided, you know what, I'm going to start with BPC 157. And in 90 days, the recovery was unbelievable. I can work out the same muscle group in 24 hours, no pain whatsoever. It was just unbelievable. Then slowly I added TB 500. Then I said, okay, there's something going on with this peptides. It must be life-changing. It can't be that simple. A bunch of amino acids doing that. So I dived deep. I did my certificates. I attended conferences. I did my own research, and it opened doors. It's just unbelievable, the growth and the state of art of peptides we're dealing with now. Can heal MS, ALS, severed nerves we're recently trying on, severed nerves, which is like conventional medicine wouldn't even touch. It's just unbelievable. And guess what? One of the most, and a lot of people don't know that, one of the most peptides used in the world is Ozempic, GLP-1. Saxenda, Ozempic, Wegovy, Mounjaro. It's a peptide, right?
Yep.
A lot of hormones in our body are peptides. So I decided to spread the word, and I decided to say, you know what? You can try it for 90 days. I have patients that I decided, you know what? I know you're scared, but I will be following you on a closely monitor. So I started patient on peptides, and I speak with them every other day and see how you feel and whatnot until you see the effect on them, and it changed lives.
Now, I know we're talking a lot about peptides. One of the other things that's really big that you're doing, and let me pause. Let me go back on this real quick. If you're watching this right now and you don't have an experience in, don't have a medical background or have experience in the medical system, especially in the United States, I want you to be able to see, and this may be something I should not say, but in the United States, the medical business is built on keeping people sick. Basically, I mean, not keeping people sick, but there is money in treating patients.
Yeah.
So, for example, if they can give you a medication, say you're overweight, out of shape, they can put you on some high blood pressure medication for the rest of your life, creating a residual income forever. Whereas if they told you some quick treatments to just fix that, lose some weight, get in shape, cut your calories, whatever, that profit source dries up. I really love that you are. I just think it's so cool that you're working on stuff that is against the residual profit generating income that most doctors are still chasing. So there's just really a big thing that I think is important. And I would like to say, if you guys are watching this right now, pause the show. You can scroll down. There'll be a link here going to his website, Dr. Demian, or drdemian.com.
Yeah.
Did I say that correctly? You can go to drdemian.com. Get in contact with him. I mean, I would schedule a genetic methylation test and figure out what are the things that you can actually do to help restore your system and work on the anti-aging stuff like that. Now, going to back pain, I know you've got so many different branches, different expertise, areas of expertise, but what is the biggest myth right now that patients believe about back pain, especially when it affects sleep?
People believe that back pain is untreatable, and if you don't get surgery, you're probably going to be suffering from it for the rest of your life, whether it's aging, especially in people for mid-30s and up. And it's quite sad myth. Back pain has nothing to do with aging, nothing to do with genetics. It is basically habitual things. Yes, it runs in families. I wouldn't say it wouldn't. So some families are just have weak bones, right? But it doesn't need to be. We did, as physicians, we didn't do our job early on when we spread that hormone replacement therapy early on, 50, 60, 70 years ago, that it is related to cancers. That's not true. Hormone replacement therapy is not related to uterine, ovarian, or breast cancer. This is a myth, and we've seen the bad results from it into osteoarthritis in the back, degenerative disc disease, because we scared a lot of women from hormone replacement therapy. Similar with men and testosterone. Till today, I still have argument with physicians, family physicians in Canada, that testosterone shouldn't be prescribed unless you're really down and running on fumes. This is again another myth, right? So all this affects back pain, right? All your habits affects back pain. So you don't need to suffer. It could be prevented, and it could be treated without surgery. I treated my back pain without surgery. I stopped the degenerative disc disease through peptides. I stopped through stem cells, injections, and infusions. I did filling of the disc with stem cells. So I had some eroded discs from a lot of car accident that I had. I used to box as well. You can imagine my neck and my lower back. MRI shows that my back is as good as when I was in my 20s and 30s without surgery. I was looking into surgery, and without surgery, I was able to reverse all this. You don't need. I started hormone replacement therapy against my doctor's advice because I felt low. I had good numbers, mid-range for my age. But I decided I'm tired. I'm not feeling ambitious anymore. My mood is not good. My wife kept saying, it's just midlife crisis. It wasn't. It was low hormones. And once I started, it changed my life.
Chasing her
Simple
around the
things like
bedroom
this.
again now.
Yeah, I feel like, honestly, I feel when I go to the gym like my 20s and 30s. It's just
That's
unbelievable.
awesome.
Yeah, so this is the myth. Back pain could be treated. You don't need a cortisone shot. You don't need to have surgery. Just look for an anti-aging regenerative medicine doctor to help you out.
This interview is sponsored by Newswire magazine. We celebrate the entrepreneurs and thought leaders shaping the future, those who don't just adapt, but innovate, who inspire others to think bigger, lead boldly, and create lasting change. Only a select few are featured in Newswire magazine, and for those who earn a place on the cover, the opportunities are unmatched. Your story shared with a global audience, your achievements celebrated on national billboards, reaching millions. Every leader has a story. Every vision deserves a platform. Who will rise to the top? Stay tuned. You're witnessing greatness unfold.
Now, I had an endocrinologist friend that I don't know the truth behind this, but I had an endocrinologist friend say that the target, and I'm right wing, as far as beliefs, I kind of want the government out of my business as much as possible.
Yeah.
But this friend was saying that the target right now for when you come in, you're an older guy getting, you're feeling out of shape and low energy and depressed and all the stuff that comes with low testosterone. This endocrinologist friend was saying that now when you come in, they want a 18-year-old healthy adult male. Your testosterone today, the guidelines, I think it was like 40 years ago, they say an 18-year-old's testosterone now should be what the recommended testosterone for a 65-year-old man was, I don't know, 20, 30, 40 years ago. And the point behind that, I was asking, why is that? They said, because the government wants you weak, soft, easy control, easy to control, easy to manipulate, and you're basically less of a man with less testosterone. Do you think there's any truth in that?
Less to fight back. Yeah. Yeah. I've seen it a lot in Canadian patients. I've seen it a lot in US patients. And honestly, if you don't advocate for yourself for anything, not only testosterone, right, you're not going to reach your potential. The government wants the system to stay as it is. You just pour money on it to stay as it is. And there's no incentive to be proactive whatsoever. We need to be proactive. A lot of people are taking charge of their health now, and they're feeling better. That's why my mission is not only celebrities or people who has got money and means. I need to spread this to others, mainstream, to take control of their life. And it's really simple. Like how much it will cost a bone marrow broth, you know what I mean, twice a week. How much it costs to have a little bit of iron in your food, whether you're eating liver or spinach or whatever. A good walk, vitamin D, it's not going to take much. Vitamin K, it's not going to take much. Vitamin K can prevent 60% of all cause mortality. It's just as simple as that, right?
Wow.
One pill a day, right? It's not only this, like something like DIM, right? Which people with testosterone also have some sort of conversion into estrogen, which is not good. Your testosterone could be amazingly and good levels, but a lot is converted to estrogen, which defeat the purpose. Yeah, gynecomastia. It's not only this, dry joints, right? Dry joints, mood, right? I learned the hard way from a patient that every time I send him for blood work, we forget the estrogen, and his estrogen was high. Once I looked at his estrogen, I knew what was wrong, and within few weeks, we fixed it, right? Just a supplement that you can get from any supplement store can fix all these problems. You do not need thousands of dollars kind of procedures. It could, yeah, you can beat this, and we can spread it to mainstream, right? And I love Peter Attia's message that just by fixing sleep, exercise, and diet, right, you can really achieve 75% of anti-aging and regenerative. The rest are supplements. Whatever supplements you want or you can get your hands on, that will get you 100% of all on any programs, right? So it really has to be mainstream.
Now, people see peptides, PRP, anti-aging clinics everywhere, and I actually know of a guy personally that has absolutely no business being in the hormone replacement therapy business. He's just doing it for the money. But they'll sell all kinds of things that are unsafe, unhealthy, basically steroids out the back door. So you come in for your testosterone, then you're getting these other things out the back door, and guys are getting jacked. They look good when they get done. But what is the safe, evidence-based or science-based path that you recommend?
This is what we do, Curtis. And that's why we separate ourselves. And this is how I think myself, right? I did this research over probably 2 years period. And I went to Dubai and I visited 6 clinics, right? In there, 6 of the like high-end clinics, spend thousands of dollars. And they go in and they don't do what you really need them to do or hope that they need to do. I asked them for one thing. I was feeling tired. That's it. Help me out. I did the plasma exchange, paid $10,000. I did the EBO, did another $10,000. I did my age, chronological, biological, paid another. I've done it infusion upon infusion upon infusion, glutathione, and this without fixing it. You can't treat this way, right? You're going to have to dig a little bit deeper. So that's why the patient comes in. We have a questionnaire that's filled. What are the 10 activities that you would like to do or to have when you're at 60, 70, 80, 90? What else? You want to play with the kids? You want to go to the gym? In my opinion, for myself, I want to go to the gym to the last day. I want to be able to drive my sports car to the last day. You know what I mean? I want to, honestly, and I couldn't believe it that adding even sex, right, which is very important. People you see it at 60, 70, 80, 90, and even 100 years, right? They want to be able to have sex, which is, you know what I mean? It's very important for them. So don't tell me that EBO or plasma exchange or whatnot. So this questionnaire is very important. Then we do a genetic testing, right? We call it genetic testing, but it's more deeper than this. But just to simplify it, it tests everything. It tests cancers, all cancers known to men, which honestly, I've seen people, and I'm guilty myself. I used to prescribe Ozempic and Saxenda, whatever, without genetic testing. I did it myself, and I have a gene that can be converted to thyroid cancer. I'm not allowed to take GLP-1, so I take it in short periods of time. If I continue like others 6 months or a year, I will end up with a thyroid cancer, right? I do have for colorectal cancer, but I don't have for prostate. So I'm able to take testosterone freely, right? But I'm not able to take other stuff. So it's very important to do genetic testing and to have a plan. Once you have the plan, that's it. You can do whatever you want. You can do hormone optimization. You can do metabolism, sleep, all these things together. And then you can go nuts on peptides that you think that will help the patient and changes. I did an experiment on myself with GHK copper, which is known now for hair and skin. So I stopped everything. I stopped all the supplements that I'm taking, even multivitamin, and I took only GHK, right? For 60 days. The results was the skin. My wife, we would be sitting on supper and she said, "What are you doing to your skin?" And I wouldn't tell her. "What are you doing to your hair?" I wouldn't tell her. Unbelievable results just with one peptide. Yeah, so you can understand that you're doing it methodically is the best way to do it, and knowing the source that you get your peptides from it. I've had a lot of people that join those clinics, and a lot of patients get testosterone instead of this, get Primo or get Deca instead of testosterone, which is not really a healthy way.
Eating Anavar and all the I'm not a Anadrol 50 and stuff that will make them blow up and also going to kill your kidneys and liver.
It's not only this. I had a patient like this, and honestly, after 6 months, I asked him, just humor me and get a calcium score. You get a calcium score, right? Repeated. So we did one, and we did it after 6 months. It changed from 0 blockage, and the numbers creeped up significantly. That's why you see all the bodybuilders don't live long. They live nice, and it's a good fame and a good life, but they don't live long. I don't expect them to live long with this major changes in your atherosclerosis or to the heart.
Now, if you've got somebody that is somebody that's doing these type of things right now, maybe there's a young guy watching this and he's looking at all of these different social media things saying, try this peptide, that peptide. Here's some. I actually have got a consulting client that was asking about investing in a peptide clinic. Basically, they've got kind of it's one of these no medical. They're going to have a doctor that they're paying a couple $100 a month to hang his plaque on the wall as a medical advisor or whatever.
And sign it.
The entire junk of this business is all they're doing is just selling anything that anybody wants.
Yep.
Not doing any kind of genetic testing or anything. But if you're a young guy watching this right now, thinking, hey, I'm going to try whatever list of peptides that this influencer just told me is going to help them. Explain how genetic testing works. For example, if you've got a gene deficiency, if both parents have it, guaranteed you'll have that deficiency. If one parent has it, it's a like partial deficiency. If neither parents have it, can you kind of break down how that works as far as the genetic testing and how one thing could work for one person great and not work at all for the other person or actually cause damage?
Yes, absolutely. That's a great question. So you look at it and you see, okay, this person, say for instance, has got family full of diabetes, right? Or family full of heart conditions, right? You look at that and said, okay, why does this family have heart condition? They have the gene. They have the gene to increase cholesterol, so they don't know how to absorb or digest cholesterol, and it accumulates, blocks the arteries. They have high inflammation. You look at the genes and you cause high inflammation. Anything can cause inflammation. And usually it's called metabolic syndrome because at one point you will develop diabetes as well. That I said, okay, this family is highly susceptible for heart condition, diabetes, and probably strokes, right? How can I prevent this, right? We look at it this way and I said, you know what? If you continue living your life normally, unfortunately, you will end up like the rest of your family. And we've seen it a lot. We've seen a family that all the males die before 40. A lot of families like that now. No male in this family, and I have friends like this. And we were able to help them live beyond and beat that. It's very easy. You put them on, you have to be proactive and significant, but the patient has to need that. I need that. I personally have the same in my family, and I was able to beat diabetes. My family has diabetes. I grow up, anybody in my family above 40, they start diabetic medication without even testing. It's just very common. My uncles from my dad's side had amputation to their legs, went to family reunions with all of them in a wheelchair. Was very traumatizing to me. So I decided to start metformin the minute I hit 40, right? I started metformin. I said, I don't care. Now, metformin is one of the core medicine we use for longevity and anti-aging.
Wow.
Just to level the base for glucose sensitivity and insulin resistance. So you can beat that. When it's not going to work, if they're not willing to change their habits, Kurtz, if they're not really willing to cut sugar, if they're not willing to cut this, you might get lucky and skip one generation of that. But do you really want to risk it? Right? I don't think anybody would like to risk that. I have my personal trainer, the same thing. His family male dies early of heart condition, and he's scared. But he's using all kinds of supplements to protect that, right? He's really into this. You sit down with him and you talk about peptides, he knows inside out. So you have to really look into this, right? With somebody who's a physician, not an influencer, with a physician that understands this and knows where to get the right supplements and when to use it. It's very important.
Now, you're actually writing a book, I heard, based on anti-aging or the belief of aging. What's the core belief that you want readers to rethink with this book, and what's the title of it going to be?
That anti-aging and aging doesn't start at any age. It starts the minute that we were born, Curtis. Believe it or not. My book is What If Aging is Optional, right? That's the theme of the book. I haven't chosen a name yet.
What if aging is optional?
Yeah.
That's awesome.
Yeah. So at age of 10, there are supplements that you need to start taking. At age of 20, there are things that it will help you. And the whole idea is your future self will really thank you for this. If I've known I will have back pain, I wouldn't have gone crazy in car accidents, right? and recovering. I wouldn't have gone crazy on sugar. I used to eat sugar like it's going out of style. I used to have this 2 or 1 pound of M from Costco and finish it at bedtime. That was my bedtime snack. It was ridiculous, right? Now I don't touch sugar at all, right? And there are stuff like this that people, and the whole notion of this, that the new generation, the younger generation girls, they are really informed, they're really educated, and they're way more disciplined than us. You can see that because I've seen the stats from drinking. They don't drink as much as we used to. They don't eat as much junk as we used to.
Yeah.
And they're very disciplined. You see a lot of a vegetarian, vegan, a healthy diet, carnivore diet, whatever, right? And the discipline is just unbelievable. I start notice that when the first 18 years old hit my clinic. I was talking and whatnot. They know what they want. They already have a diagnosis in mind. I'm there just to assure them this is the right, and they know what they want. When I tell them take this pill for the rest of your life, they look at me as if I have 2 heads. When I tell them that, you know what, I'm going to do an epidural and I'm going to see you every 3 months, they think I'm crazy, right? They want a fix,
Yeah.
right? So helping them don't get sick, treat the root cause, this is my mission. This is the wave, this is the movement that we have to get going by helping this generation. And the people who are already having pain, why can't we help them with that as well by treating the cause, right? Pain clinics, unfortunately, are trained to do this. Bring you over and over and over and get injection. I will see you next week and the week after, and in 2 weeks and 2 months or whatever. You don't need surgery. Just keep coming. You know what I mean? I'm tired. I tell my
Residual
patient,
profit center.
yeah, I tell the patient, you know what? I'm happy to see you. But at one point, right, I need to shake your hand, goodbye, and see somebody else. Right?
That's
I
awesome.
love doing that. It's actually one of my, and I tell the patient how long I have to do this. I said, okay, we're going to try. If it doesn't work, I'm going to do this and this and this. And we have a plan, 6 months, a year. And thank you so much. We're done.
That's one of the things when I met my wife and we started talking, she's a mental health practitioner. She's got her own clinic here helping people with mental problems. But one of the things that I love, I mean, I interview everybody. And as I was talking to her, what's your main goal trying to help patients? She was saying, I want to help them get over their problems, figure out how to say, hey, you're done here. It was nice knowing you.
Yeah.
Let me move on to the next client. I really love that about you as well as my wife, that's something you were trying to get rid of that residual income.
Feeling.
Yeah.
It is the best feeling. Thank you so much. They come, you know what I mean? We say, okay, you're discharged. Now you're good to go. Bye. Right?
That's awesome.
And that's it. It just, you don't need to hang on to the patient for dear life. You know, your mission is to just get them reach their potential and move on. And that's honestly what brought me to chronic pain management, not to keep milking the system this way.
Yeah. Well, that's something good business. It doesn't have to be just medical or mental health, but any type of good business. If you are really good at what you do, you can solve a problem for somebody, get that person out, get that. You will generate more revenue, more business by having that person that you solved their problem instead of keep milking them. If you can solve that problem, they're out spreading the word to everybody else about how great you are and how great they feel. I mean, it seems like just a no-brainer as far as way to run business, even if you were a bad person that didn't like people. I don't understand why clinics run like the opposite of how you do.
It just, it boggles my mind as well, Kurt. It's just unbelievable that people say, you know what, you don't need that. Just come over. We'll do an epidural. We'll do a cortisone shot and just move on. When somebody's still doing cortisone shots, or I just boggles my mind. We know that this is a quick win, but it's not a fix. It's a quick win. It's a win-win situation. But you get billings for this as well as the patient got better, and they just keep coming back. I send the patient. We tried, not working. Let's try anti-aging regenerative. If not, they're willing to go for surgery. We send them straight to surgery.
Now, that was my next question. I was going to ask you, would you walk us through your conservative to regenerative to micro-invasive pathway? And what does the sequence work? Why does it work so well for your patients?
It's all about expectations. The patient comes and we look at them and said, okay, this is what you have. We get your MRI, and this is what you have right now. Let's try something. You're not ready for surgery yet. Surgery is probably in your future, but not in the near future. So let's try something now. So we try conventional medicine. We try RFA, radiofrequency ablation. We try nerve blocks. That doesn't work for you. It doesn't give you the relief that you want. And we time it. We're going to do this 3 times or 4 times. It didn't work. Why don't we try something else? Stem cells. I think you've got this. Stem cells will work because there is a cost attached to this. So we don't want to force the patient to absorb that cost. And unfortunately, it's not covered by a lot of insurance. So it's out of pocket. So we do stem cells or PRP plus the radiofrequency ablation, which I did to my back. And then we see how much relief the patient. You've got 5 years relief from that, which usually the case. Is that enough? Yeah, that's enough. Or you know what? I like you, Dr. Demian, but I don't want to come back. I said, okay, let's explore surgery now. What is surgery that are available for you? What about minimally invasive? And let me tell you a little bit about our surgery, because conventional surgery anywhere else is like 5-inch. We cut the patient open, we carve the muscles, carve the bones, get to the disc, remove the disc, put pins and screws and whatnot, and we close. The patient is stuck for 6 months in rehab and recovering and whatnot. Ours is not like that. It's a 5 millimeter incision. We go in, we don't cut anything. We spread between the muscles. We go through the bone and we go in and peel the disc. So we peel the lamina. So that's what's called laminectomy, or we put the screws to do a fusion and we inject stem cells after, right? Stem cells heal and keep the screws in place. Once this is done, we go out. In 3 days, the patient can get up. The patient actually walks out of our surgical center. We don't let any patient go home in a wheelchair. They have to walk. They walk. In a week, they're back to their office and they're back to their job, golf course, swimming, whatever they want. Don't do anything heavy like going to the gym. That will take 3 months. But generally speaking, back to all their activities within 1 week.
Wow, that's insane.
Yeah.
Now, which genetic tests, whether it's methylation, genetic labs, imaging, most often changes the patient's treatment plan?
Genomics is quite important, as well as epigenetics. So we look into the supplements. We look at the age of each organ as well through epigenetics. So if the patient is 40 years old and their spine is 60, really important to see what is causing the problem. Why is the spine or the liver or the lung are aging faster? There are certain kind of supplements. Our system will spit out some changes, whether could be something as simple as lack of sleep, right? Could be inactivity. People think that, okay, I'm not doing a lot of sports, I'm not going to get injured. Like my lawyer said, I've never played sports in my life, I have no injuries. Let me have an MRI to your back and we'll decide, right? So anyway, that's really important. You look at the epigenetics, you look at what's the age of each organ, and then we'll decide. We'll decide how to push. If it's osteoarthritis, okay, so we need to have D3, we need vitamin K, we need calcium, we need prolia to increase the osteoclast and osteoblast activities in the bone, so that we build the bone's activity, build the bone better. And then we look at the genomics. Genomics, how are all these genetics are dealing together, right? And like you said, methylation is the best way to deal with it. If the genes are not working properly, how can we do it, right? We give them supplements like selenium, like methylades, NAC, CoX10, and all these supplements that will help accelerate or increase methylation in this. Sometimes we actually give infusion, like a consistent infusion for 6 days, 6 times, 6 consecutive days, just to get this going. And that usually help activate those genes and bring them back to processing the information. So once you get this done, it really a matter of time. When you do another MRI and you look at the back, I said, okay, the bones are getting healthier. That means that we can fill the disc now. We can do filling the disc with stem cells, right? And that usually remove any spinal stenosis or any pressure on the nerves going or any impingement once you fill that disc and give it more space.
Wow. I did genetic testing and all the methylation testing, all of the real in-depth testing. I've been on all the methylated vitamins and stuff for years. And this was through another provider, but they said it is absolutely impossible to reverse the genetic mutations that cause those issues. Am I misunderstanding that you just said maybe there's a way to actually
You don't
slightly
reverse them, you
reverse
turn
those?
them off or turn them on. You don't reverse them. He's right. But you turn them on or turn them off. You can do that through a targeted infusion.
Really?
Yeah.
Now, that's something I'll have to talk to you about afterwards because I've got, for example, a 5-MTHF deficiency, but that's something you could actually fix, right?
Yeah. Right now, it is very possible.
Wow, and this may have been something that was just not possible a few years ago when I did the testing, or maybe that's something where it generates that residual profit source that, they keep selling me the same pills every month, but I'm excited to connect with you about that as well.
It is rapidly and fast growing subspecialty in medicine, Kurt. It's just unbelievable. Like, even I work in this field and I look at the studies every day. It's just unbelievable.
Wow. Now, kind of a different subject here. Wearables are exploding. I mean, as far as everything from the rings that track your sleep and blood pressure to Apple Watch, what single metric could you actually act on each week for longevity?
Sleep number one. And when I hear Peter Rea talking about it, he's absolutely correct. Sleep is the best one. If you're gonna look at one thing in the whole wearables, is your sleep. Recovery and sleep. And recovery from sleep is the best. If you are sleeping and you're not having a good sleep, whether it's sleep apnea, whether it's stress during sleep, whether it's you don't have a REM or a non-REM movement to your sleep or whatever, right? If you can fix that, inflammation will go rampage in your system. Organs will age faster. And some of them, like Whoop, will tell your age based on your sleep and recovery. I wear it all the time, and it's just fascinating. So sleep is the one thing. Number two, exercise. Exercise is the single most potent, accurate indicator for aging. And it's very simple. And I tell this to all my patients. If you don't have the muscle power or the muscle mass to be able to go to the grocery store, get in and out of your seat, go upstairs and downstairs, play with your kids, I don't think you're gonna age peacefully. It's just very hard to see it because I was talking to another podcast and she mentioned that she's seen somebody at age 65 had a knee injury and they deconditioned pretty fast.
Yeah.
Which I've seen it a lot. I've seen it a lot in my patients, and because the system in the Canadian system takes a long time to do a knee or hip surgery, you can see it how much they deteriorate. But we should look at their baseline before injury as well, Kurtz, right? How active they were, right? And the patient will tell you, oh, I was active. How active? You go to the gym, you go for walks. What's your muscle mass, right?
Yeah.
All those indicators are extremely important, and we cannot ignore them before or after injury.
What does a month of your white glove longevity membership look like?
It's a very comprehensive service. We've got 3 levels. We've got the silver, the gold, and the platinum. But there are basics for all the service that we're doing, which is everybody should get genomics tests, epigenetics. We add DEXA scan to it as well. It's very important to check the DEXA scan to see how much fat, how much muscle mass, and visceral fat is very important as well. And I had a bad experience with my energy where I was lacking energy, really drained for 6 months, visited a lot of clinics, especially the high-end clinics in Dubai, asking what it could be. And I've done a lot of things. They've done a lot of tests, but they ignored the GI, the microbiome in the GI. And we take this lightly, we take it for granted, but it's very important. We all travel, we all eat out, right?
Yeah.
And we all can contract a bacteria, a fungus, a toxin that will drain your energy and much more, will give you fatigue. I've seen it causing fibromyalgia for a lot of patients and much more. So I was lucky to work with my naturopath, and he's working with us in the program as well. And we figured out, I did the test, and sure enough, 1 course of antibiotic, a simple peptide KPV, together with what I was already taking, BPC and TB. And in 45 days, less than 60 days, I was back with all my energy and much more. Really life-changing. So we provided in any and every program that we have, do the genetic testing and do the microbiome is very important. And you will discover a lot of things, including aging for some of the organs because they're not taking the supplements. You're not absorbing the supplements, the good stuff, and you're wasting money on supplements that will never get absorbed. You're wasting money on food that will never get absorbed through your stomach. So why? It's a very simple test. I know it's not pleasant, but it's very simple test, and it's very important. After that, we work with our patients on a weekly base infusion and a monthly supplements that we send them a box, whatever they are, right, that will match their needs. We observe them and we actually look into, we provide Whoop to most of our patients, and we log into their account and we look into the sleep, the recovery, heart rate, respiratory rate, and our AI system will look into this, will look into the data, map it out, and will come with the best suggestions that we enter the data into. And we'll come up with whether it's as simple as a habit change, supplements, increased water, electrolyte, or a little bit of better sleep hygiene. Once we get to that point, 6 months later, we repeat the blood work and the DEXA scan, and we show the patient the results in scientific way, not just I'm feeling good. No, your muscle mass, your insulin resistance is getting better. We like the patient to be committed to that. Otherwise, unfortunately, we let the client or the patient go because we really like patients that were compliant to this to get the results, and we don't want to waste your time.
That's kind of like a personal trainer. If you're going to the same personal trainer for the next 5 years and you're still fat and sloppy and out of shape and overweight and you're not getting your results, and they're telling you, well, just keep going, just do it a little bit longer, they're strictly in it for the money. Now, if that's somebody that is willing to cut you loose, that means they're successful enough. They've got enough clients on the back end that are getting results that they can tell you, if you're not following the protocol, this isn't going to work out. Go save your money and enjoy it somewhere else. But I can't help you here if you're not going to help yourself, right?
I feel it's a contract. We signed a contract together. You came to me and you want to continue living healthy and reach your potential. I don't want to fail you, right? Because I feel like I'm failing you if you're not getting what you paid for or for what you came here in for. So why wasting your time? You know what I mean? Unfortunately, I wouldn't waste your time. And our program, we have very limited number of members. We're not looking to have thousands. We're really looking at a limited number. And I think somebody else who are willing to commit will be better off using that membership.
That's awesome. Now, give me a final call to action, final piece of advice for somebody who's watching this right now, whether they're dealing with chronic pain or they're looking to prevent or reverse aging. What advice would you give that person?
That's a great question. If I give one advice is aging is optional. You don't have to suffer from pain because you're getting old. You don't have to age and slow down. You don't have to give up on your hopes, dreams, potential because you're getting old. That's not true. It's very simple mindset change that can set you to success, and you can fight it, you can reverse it, and you can stop aging right now.
Powerful. Man, I appreciate you being on the show. This was an incredible conversation. And if you're watching this right now, I'd recommend go to, check out the websites here. There's PraesentiaHealthcare.com. And then also, if you go to drdemian.com, we've got some great information. I would recommend just get in contact, and there's a lot that he's going to be able to help you with here. Thanks so much for being a guest on the show. This was awesome.
Thank you so much. I really enjoyed it. I hope that we can inspire few of your audience with what we talked about.
Thanks for watching Success, Motivation, and Inspiration. This episode was designed to help you level up. See you next time.